I'm glad you said that because whenever I hear someone say the body is attacking itself, my hackles go up because I just know the body is about survival and it wouldn't
Right.
attack itself without a specific and very urgent reason.
Cue music. Places, everybody places. We're starting in 3, 2.
Welcome to the Autoimmune Hour, where we look at the rise of autoimmune disorders. I've brought together top experts that range from doctors, specialists, nutritionists, researchers, and even those recovering from autoimmune to bring you the latest, most up-to-date information about autoimmunity and how to live your life uninterrupted.
Thank you for joining us here on the Autoimmune Hour with Sharon Sayler. Always seek sound legal, medical, and or professional advice regarding any problems, conditions, and any of the recommendations you see, hear, or read here on the Autoimmune Hour, Understanding Autoimmune, and Life Interrupted Radio. Join the Autoimmune Hour's Courage Club. Sign up now at understandingautoimmune.com. Now, back to your host, Sharon Sayler.
Welcome everyone to the Autoimmune Hour. I'm Sharon Sayler from SharonSayler.com and of course from UnderstandingAutoimmune.com. And I'm not in my regular studio today. And it's been one of those weeks where, everything that could go wrong went wrong. So I've compiled some of my favorite aha moments from a few of the last shows. I hope you enjoy some of the review and hopefully you have an aha or two like I did. Enjoy. See you next week. So fasten your seatbelts because I'm introducing Dr. Jenny Tufenkian. She is a naturopathic physician and she has been treating chronic illness for over 2 decades. And having complex chronic fatigue herself, she had no choice but to dig deep into the literature and uncover the root causes of chronic fatigue. And through her research and experience, she's developed an effective system to unlock the 5 core root causes so that people who are too exhausted to function can function. I think, what a novel concept. So one of the things we're going to talk about today, because I think it's really important, is brain inflammation. You might be going, what, Sharon? Yeah, so the kind of the pain, the stiffness you get in your hands or your feet, maybe. You can get that in your brain too, right? Jenny, help me out here because I've been seeing what I think a lot more people talking about brain inflammation. How do you describe brain inflammation? Because in my research, I saw the medical encephalitis, and I also saw what they were calling neuroinflammation.
Were you thinking myalgic encephalitis, ME?
Yes, absolutely. That's what
myalgic encephalitis is the term that people are trying to move, replacing chronic fatigue syndrome with myalgic encephalitis. It's what most of the world uses. There are other terms that they're trying to use as well. And the myalgic encephalitis does seem to explain better what is going on with people with chronic fatigue syndrome. And you talk about the autoimmune. I know this is the Autoimmune Hour, and I love coming back on here with you. I have always held back from identifying chronic fatigue syndrome, ME, as an autoimmune condition. I did a presentation a few years ago to some physicians. They invited me to come talk on an autoimmune panel with a bunch of doctors. And I would say there's autoimmune-like behavior dancing around this. And I realized that some of that's my own resistance to this identity of autoimmune condition, because I think that it's easy to over-identify and feel powerless. And I'm all about people feeling empowered when they're dealing with their healthcare. And I think that that was my block. Personally, I can own that. When I was diving into the research around the newer upcoming research and starting to look at what we can now see is happening in the brain with inflammation, it starts to make a lot more sense that the fatigue and a lot of the symptoms that people get from chronic fatigue syndrome, myalgic encephalitis, or from all of these other autoimmune conditions, or from stress, traumatic brain injuries, anything that creates impact in the brain, toxic exposure, is an autoimmune condition. It is the body starting to destroy its own cells out of an act of self-protection.
I'm glad you said that because whenever I hear someone say the body is attacking itself, my hackles go up because I just know the body is about survival and it wouldn't attack itself without a specific and very urgent reason.
Exactly. There's something that it is sensing And there are different things it can be sensing that's leading it to act this way. It could be that there's a low level toxin in there that we can't see and haven't tested for, an infection, a heavy metal, a pesticide, that kind of thing. Or it could be that the signals, it's a lookalike problem. You're arresting the wrong person because they have a similar profile. And that can also be
That's
going
a
on.
great metaphor. So,
It looks close enough. We're here. We've got the handcuffs and the gun. Like, we might as well do it. Unfortunately, we all know this is a real problem in the world too. With that.
let me talk about that though, because the thing that's coming up for me and one of my recent explorations that have helped me a lot is understanding the role my autonomic nervous system plays as well. The sudden rush of an adrenaline, it
Right.
messes up my whole body chemistry, even though logically I'm safe. There are times when the body, I'll just feel this rush of adrenaline and I'm like, okay, what is my autonomic nervous system trying to alert me to? So that messes with the brain, I think, because then could be all of a sudden some anxiety pops up and all sorts of other things.
Are you talking about the adrenaline rush you get from thinking about something where you consciously know you're stressed out about it? Oh, I didn't hit record for my last podcast.
Yes, but it's both, because sometimes I'll just be walking and it's almost as if my spidey sense goes, and I'll feel something and I can't really put my
Yeah.
finger on that. Yes, not hitting record.
Yeah.
Inside joke, folks. Works because that definitely is a rush of adrenaline and
Yeah.
self-condemnation. I also sometimes feel it, just maybe case in point, not so much now, but during the last couple of years, I was hypersensitive to where I went and how I went and when I went.
Mhm.
And one time I was in a large department store and I heard someone coughing just like 6 feet away from me, like
Mhm.
hacking up a lung. And that just set my nervous system all aflutter.
That adrenaline rush, especially if we're in that chronic adrenaline rush state of mind, it can definitely begin to be part of one of the picture that can lead to this chronic inflammation in the brain. And one of the things that we've talked about that we know is one of the things that I find really interesting that I'm beginning to see is I'm thinking about patients, thinking about my own personal history, my family's history, looking at the literature, listening to the latest presentations from the NIH on chronic fatigue and ME, is that there's a real common thing that's happening when you have people who have a tendency towards depression and or anxiety. They have a chronic fatigue, my ME or autoimmune kind of picture. They have brain fog. All of the things that are happening in the brain are the same with this. It's all the same kind of inflammation that's happening in the brain. And the thing that I think should really get all of our attention, certainly has mine, is that it's the same thing that leads to dementia. The Parkinson's, the ALS, it's all the dementias. It's all about brain inflammation. It's all about that blood-brain barrier being leaky, things getting through it that shouldn't get through. Again, the toxins, the viruses, those kinds of things. And then the brain having a response to it that gets out of control, that doesn't stop.
Which makes sense if we think about, I don't know why we think about our brain differently than our gut or something, but if leaky gut, which they've proven is a real thing,
Yeah.
we have a leaky brain.
Yeah, it is the same. And if you have a leaky gut, you have a leaky brain. And if you have a leaky brain, you have a leaky gut. And you also have leaky mitochondria. If you have either of those, you have leaky mitochondria.
Oh my
And
gosh, I feel like I need an umbrella here.
no, you don't need an umbrella and you don't even need fear. And that's the thing that I feel like is really important to interject right now. There's a certain amount of fear that motivates us and pique your brain and go, oh, I need to pay attention to that. I don't want to become like grandma or dad in my case. Yet I really think that we should use that stimulus of, oh no, this could get worse if I don't do something about it, as a stimulus to get us to really own our own power and what it is that we can do for our healthcare so that we can start feeling better, so that we can stop this cycle. Dale Bredesen, who wrote The End of Alzheimer's, he's great. I had a chance to meet him this fall and I got to tell him the truth, which is that he has a small following of naturopaths who just absolutely adore him because he, as an allopathic minded physician, he went in to find the cure for Alzheimer's. He was looking for a drug for Alzheimer's. And he went and became a researcher, then realized he had to become a medical doctor and ran a clinic just studying Alzheimer's. And what he found out was it is reversible. You can slow it down and reverse it and not get it. And the way you do this is all through lifestyle, like all of it through lifestyle, which is crazy. And I'm not crazy, but it's crazy that there is, what I mean by crazy is that you've got somebody who studied this for 15 years, and this is the conclusion he's come to. And so I think, again, it's just important for us to realize the amount of impact we can have with the decisions we make every single day about what are we eating? How are we eating it? How are we breathing? How are we handling that stress response that is in our body that comes up automatically? What are we choosing to do? And when do we notice, like you in that department store, we all have that. We have, whether it's conscious or subconscious, we have things that trigger that stress response. And the question is, how quickly can we recognize it and then choose to direct our nervous system into a different state?
Absolutely. And there's so much to cover there. One of the things that I did want to just backtrack about and describe how people describe brain fog to you, because I think people hear that and they also hear the term fibro fog and other things like that. If you had asked me a few years ago, are you having brain fog? I would have said no. But now that I have a more nuanced idea of what brain fog is, my answer would have been completely different back then. So let's
Right.
describe what are some of these things that we might be noticing fall into this catch-all term of like brain fog or fibro fog or brain inflammation.
That's such a good question. People have different experiences of it. So I'll give you some of the things that patients have told me and what I've experienced myself when it's there for me. So it can feel like cotton wool in the brain. It feels, oh, if I could just, you want that cup of coffee or something like that to just clear the clouds. It's a little bit fuzzy in there. It just feels like you can't think. A lot of people who are professionals who are used to having a thinking brain that functions at a high level, it can feel just, it's a little bit like, how come I can't just get my engine to turn over? What's that? You're trying to get the engine to turn and the battery's not there. It's like, it's not quite happening. That's one of the things. The other is you're noticing that things are more challenging, and that can be a whole array. So one could be word finding is a sign of brain fog. What's her name? The one with the cat, the purple cat. It's like, what's her name? Or it can be not things, places where you should feel familiar, don't feel familiar anymore. I had very, very severe brain fog during one of my mold times where I was driving away from the building where my husband works, and I didn't know where I was. Now, the thing is that we own that building. I directed the remodeling of that building. I know exactly where that building is. But because my brain fog was so bad, I was actually lost in a familiar place. That's an extreme form, and that freaked me out. It also scared me because my dad at the time had been diagnosed with a dementia. I was like, oh, here I go. But fortunately, that went away. The other kinds of brain fog, it's interesting, the brain fog, brain fatigue is right next to each other. So brain fog and brain fatigue can be like, I used to be able to concentrate for hours reading difficult text. And now after 10 minutes, I'm kind of like, oh, I'm distracted and not able to focus as well. It's if you were able to write briefs or papers or do your work, and then you're finding that your concentration time is down, you're not finding you can connect higher level concepts quite in the same way as you used to. Those can all be signs of brain fog. Too often, those people go in and start complaining about those at age 40, 50, 60, and they're brushed off and told, oh, it's just normal aging. That's not true. We have people who are in their 90s whose brains still work really well. There are things that we can do to keep our brains so that they are high functioning throughout all of our decades.
So I wanted everyone to go over to Tufenkian.com, and she's got all sorts of free options there, and you can get a hold of her if she's sparked your interest, because she's awesome. She has loads of experience to help you through this. She is someone who's been through it herself, and those are the kinds of people I like working with, because I don't always have the words to explain what's happening, but if they've been through it themselves, they get it on that level. And your URL is what?
drjennytufenkian.com. Jenny, Jenny, Tufenkian, T as in Tom, U, F as in Frank, E, N as in Nancy, KIAN.com.
Thank you so much, Dr. Jenny, for sharing with us today. And we'll have that up on the website, everyone, over at understandingautoimmune.com as a clickable link as well, because sometimes remembering her last name, that's why we all lovingly call her Dr. Jenny. And she's awesome. And I don't know if you follow social media at all, but sometimes I get into these algorithms, maybe. I'm not sure why, but I'm seeing more and more people saying as adults they're being diagnosed with ADHD. So I'm totally fascinated by all of the new things that they're finding out. And I have some dear friends that introduced me to tonight's guest. Her name is Dr. Connie McReynolds, and I'm going to read her bio because it's pretty amazing. I'm only going to read the first part, but it's an amazing bio. She's an accomplished professional in the field of rehabilitation counseling and psychology, and she has over 30 years of experience, and she holds licenses in psychologist, certified rehabilitation counselor, certified vocational evaluator, and her expertise is helping make a significant impact in the lives of individuals across all age groups. Plus, she is the author of the amazing new book. I'm going to read here also to get the title right. Solving the ADHD Riddle, the real cause and lasting solutions to your child's struggle to learn. Welcome, Connie. Thanks for being on the show.
Oh, thank you so much for having me. It's a pleasure to be here today.
The more I delved into my own healing process, I realized one of the things was how the impact of the brain. And please describe for us what ADHD is for you, because I think we have a variety of people saying they're ADHD or whatever, and maybe or maybe not.
I do think it's a very relevant topic, obviously, because I wrote a book about it. But the conversation starter here, which is defining this, is a really great place to begin. It's attention deficit hyperactivity disorder, a term I'm not really fond of, I'll be honest. I've been a psychologist for 30 years and rehab counselor for 30 years. And to me, everyone has their own definition of what this thing is. And that's part of the challenge is really defining what people have and then being able to figure a pathway out of it. And really, the concept is sadly that if you have this, you can't ever get past it. And I don't believe that. And my work over the last 15 years has really been about changing the narrative of that. Yes, people are inattentive. Some people have trouble remembering, and we'll get into some of this, what some of these behaviors look like. Because in my world, what I've discovered is that if we unravel the symptoms, which are the behaviors, and if we dig a little deeper than just the surface of the band aid that gets placed upon some of these things in our world, we actually find out that for a lot of people, I would say 85 to 90% of the people who come to my clinics, at least, have something else going on that we can tackle. And when we tackle that, we actually get rid of those root causes for the symptoms and the behaviors that people are seeing, both in children and adults. And so the banter of the ADHD, I know when it first came out with the new DSM-5 about 10 years ago, there was a lot of uproar because a lot of people felt like almost anyone now could qualify for a diagnosis of ADHD. And does that really serve us? Does that really move us in a direction that helps people? In some cases, having a definition of what something is, yes, is very helpful. In other cases, it's stigmatizing. So I think we have to really check ourselves on, are we creating stigma? Are we creating a pathway forward? And that's really where I begin, is what can we do to move forward?
I love that. Moving forward, that's what we're all about. Just have the label, but move beyond that. You're not your labels.
Exactly.
But speaking of labels, I'm just curious. So is ADD and ADHD the same thing? I hear those two acronyms bantered about, and I'm very confused about the meanings of them.
Most people are. And I think it's because it is confusing. So ADD is attention deficit disorder. And as I said, ADHD has the hyperactivity piece in it. I'm not sure how helpful any of that is on the bottom line, but it may start a conversation. So if it starts a conversation and it moves someone forward in seeking assistance in helping themselves get better, then all good. If it becomes this thing, oh, I have ADHD, I can't do that, that's something else. And I really have to look at that with the person, the adult or the child. But really, the firm diagnosis in DSM-5 is now ADHD. But people still use ADD. And I think in part because there are significant differences for how this shows up in an individual's life. And what I learned early on is I can have 10 people walk into my clinics on a day, any day, and all 10 of them are going to look different. They're going to have a little bit different story. There's going to be a uniqueness to how they're living their life. And what I came to understand is that we can separate some of this out into what are auditory processing problems and what are visual processing problems. And when we get away from or dig deeper into what the behaviors are, what the challenges are in a person's life, we're going to have a better shot of understanding those behaviors instead of just saying, oh, this person is just willfully not doing something. And that's part of what I really focus on in the book is that people who have this are not willfully trying to cause other people trouble. They're not willfully not paying attention. If your brain cannot remember something, you can't remember. So it doesn't matter how many times a parent will tell a child or their spouse to do something. And if that person can't hang on to it, they can't hang on to it. It's not because they don't want to. And particularly for children in the classroom or with parents, they don't want to be scolded all the time for not paying attention. That's the last thing they want to know. And so when we can unravel this, I use an assessment that gets at this in about 25 minutes. I go over it with the parents or the adult in my clinics or wherever the person is. And with that information, it's about a 15-page report. I can point out those areas of 37 areas. What's working? This is a strength. So when something lands here, it's in your wheelhouse. It's where things are working good for you. But right next door to it can be a hole, can be a place where your brain just isn't hanging on to this. And you're going to feel like some days you're losing your mind because it's like, why can I do this today? But yesterday I couldn't, vice versa. So it's really understanding what's happening. It's understanding those challenges that are facing that person in their life. And that's what we're all about. It's like identifying the strengths, but then finding those areas of weakness that are causing the person difficulty. And then here's something we can do about it.
Wow, that's amazing. I skipped right past the commercial break, so everyone will be right back after this quick commercial break. Welcome back, everyone, from that quick commercial break. As I mentioned before, I've been mesmerized this whole idea of that you're not stuck with the brain that you've got. Or if it's brain fog, maybe this can help, all those sorts of things. So let's jump back in with Dr. Connie McReynolds. She's been sharing with us all about ADHD and how neuroplasticity and our brain can work. One of the things, and I'm going a little tangential here, but in my recovery process that I found was when there were those moments where somebody could confirm my sanity. It
Mhm,
was like to find these missing little
mhm.
parts and have workarounds.
Exactly. It's a relief to people. And I know I had a gentleman come into my clinic several years ago. He was in his mid 50s. And how he found me, I still don't really know. I don't recall exactly how he found my clinic, but he showed up and we ran this assessment. Part of the interview process is I'm understanding what's working, but what areas are not working. And then we do the assessment in another room. So I'm not present for that assessment. I have a clinician or a technician run that computer based assessment. And then I review it and I come in and I go over that with the person. So there's no influence of me in the assessment process. It's just a clean, objective assessment. It's computer based. And when I started going over this, he had told me he was in jeopardy of losing yet another job, that his boss would tell him to do things and he just simply couldn't remember it. He thought he probably wasn't very smart. He used really inappropriate, self deprecating statements about himself. And he just felt worthless because he couldn't hold on to a job. And I ran these assessments and I started going over this with him. And it's like your auditory processing is really weak here. And so you're going to have trouble hanging on to what someone's saying to you because your brain has skips in it. It just skips. You have a skip here. Someone will be talking to you and then you'll miss a few words and then you'll realize you missed something. And then you're going to be thinking about what you just missed. And then you just missed the next thing that came along. And so now you don't know what's going on and you feel really frustrated and like you can't figure it all out. And bosses are going to get really frustrated because they're going to say, I just told you what to do. What's the matter with you? And that was what was happening. And so when we worked with him and strengthened that up, then he could remember what people were telling him to do. He could remember what his boss and supervisor were asking him to do. It's a game changer. All this time, he thought he wasn't very smart. It wasn't that at all. His intelligence had nothing to do with this at all. It had everything to do with the fact that his brain couldn't hang on to auditory material very well. He was much better with visual, but you can't tell your boss to write that down for you if you're in wait, can you write that down for me so I can catch this? Your boss isn't going to do that in a lot of cases unless you go to HR and request some reasonable accommodations at your job, which you can do once you know what this is. But in the meantime, most people don't know that they can do that, and they don't even know how to actually request support because they can't describe what isn't working. They don't have the language for it, and this gives them the language.
That's amazing because I can think that if I was in my 50s and I went feeling like what you described there where my brain wasn't quite keeping up, I would miss little parts in the short-term memory. I begin to think all sorts of awful things. Oh my gosh, is this early dementia? I can imagine that my autonomic nervous system would run away with me on
Mhm.
some sort of really terrifying train to find
Mhm.
out that I'm thinking all sorts of catastrophic things.
Yeah, and it isn't that at all. It isn't that at all in most cases. I do check memory, so I will say that we also assess people's memory conceptualization and sequencing just so that we have the whole picture, how all of this is fitting together. And auditory sequencing memory is a really big thing in school and in our lives. And if you don't have that skill set or ability in your brain, you're still going to miss other things. And so the beauty of all of this is we can train the brain to get stronger and all of that. And it's just repetition of doing it. It's a cheat code for life in some ways because we do a training plan for people and they just practice it like going to the gym. It's just their brain practicing this until it gets strong enough in those neuronal pathways to be able to hold that pattern now in their brain. And then their brain just naturally starts going that direction because that's the strength now in the brain. And so those patterns get stronger. And the more you use them, the stronger they get. I also joked with people, it's like that's why those bad habits are hard to break because they're hardwired in. You have to build a new pattern so that old habit that you don't want prints itself away. And so you have to build something new in its place to get rid of.
Now, this might be a bizarre question, but are you born with it or can you develop it from, I don't know, some sort of trauma or head injury or
The
say,
answer is yes.
okay.
Yes. All of the above. So the multiple choice question answer there is all of the above.
I know this
Because
sounds strange because when I got COVID and I was going through the recovery process of long COVID, I was dyslexic for a while and I'm a
Mhm.
writer. And that was so frustrating. At least my brain was trained to know when it was misspelled because I used to be able to spell. They chalked that up to brain inflammation, but this is fascinating to me. So you could be fine one time and then all of a sudden, for whatever, who knows, trauma,
Mhm.
injury, illness, something like that, you could find that your brain isn't processing the way it used to be.
Absolutely. We know that neurofeedback, and that's really kind of what we're dancing around here is the term EEG biofeedback and neurofeedback. There have been good studies about this for long term memory enhancement. We've been working with people with long COVID and adverse vaccine reactions that look pretty similar to one another with issues of brain fog and neurofeedback. So there have been good studies about this for long term memory enhancement. We've been working with people with long COVID and adverse vaccine reactions that look pretty similar to one another with issues of brain fog, and neurofeedback's been used to treat what they call chemo brain fog. And so people who've been through chemo sometimes have what they call brain fog. And there's research out that came out of the Cleveland Clinic years ago. I used to live in Ohio. So it came out of the Cleveland Clinic years ago, where one of the head nurses had run a pilot project with women who were recovering from breast cancer and had brain fog. And she had 20 some people in that project. And I think all but two of them using neurofeedback had been able to clear out some of the brain fog. So there's evidence out there. This is evidence based material that is happening out there that literally we're capitalizing on the strength of the brain, which we have. We have it from day one to day end. Whenever we leave the planet, our brain still has the capability of changing because it's changing constantly. And that's really based in the scientific discovery of neuroplasticity that happened, gosh, back in 1949 with Dr. Donald Hebe. who was a Canadian psychologist that kind of figured that out. So it's there. We can just capitalize on what our amazing brain is capable of doing. And by channeling it in typical manner, like if you think about going to the gym, you'll have a training plan typically that you go through the process. And this is very similar to that because at the gym, you're training your muscles. And with this, you're just training your brain. And so it's non invasive. There's nothing being done, there's nothing being administered to you, there's no shocking involved. I used to go out and do presentations before COVID, and people would say, "Are you going to shock us?" I said, "No, we're not going to shock you, but your results might be shocking because you might be able to actually do things that you have had some difficulty with in the past. So maybe we can help you strengthen some of this."
It's interesting that you mentioned like a chemo brain and that things because a lot of the autoimmune conditions, the medications you take are either related to or very similar to chemo. And
Mhm.
oftentimes the response can be similar where you can get brain fog. It's also known as if you have fibromyalgia, it's called
Yeah.
fibrofog.
Mhm.
It's interesting. To me, it all relates down to brain inflammation.
Yes, there's a big piece of that's happening with people. Absolutely.
What are some symptoms that we would find if ourselves like, let's go up to the adult level for a minute. You
Mhm.
mentioned
Sure.
the guy who came in, the 50-something guy who came in.
Mhm.
What are some things that might lead me to believe that maybe it is ADHD? If I'm an adult, I know you said it's very varied, but what are some of the things that I might go, I better check that out?
I think it's a good starting point because people certainly, I think people have this notion of maybe they can't remember where they put things. And so I'm just inattentive. And that could be true. Absolutely. We all have our moments with that. For adults, I like to break it the same way I do with kiddos, which is let's look at what auditory symptomatology can look like or behaviors. Let's look at what visual can look like. And so I think with auditory, we can resonate maybe a little bit better with that because it's the thing. I've told you that 100 times. We had this conversation last week that we were going to go do something this weekend. The wife says to her husband, or the husband says to the wife, and yet it doesn't resonate. It's you didn't tell me that. And so here ensues this argument about did this conversation take place? One person has the recall of it, the other person doesn't. So the person who doesn't have the recall of it does not recall it. So there ensues the challenge that they have is, am I losing my mind? I don't recall this conversation. So now comes the self doubt, the self questioning. And the spouse thinks they're just being inattentive. You're just not paying attention to me. So then they start personalizing that situation. And now you have conflict building. And so you can have people who you're talking with them and you just notice they drift off. They're not there with you. They can have a drift process going on. They may not be able to focus. They'll say, I can't listen to you when the TV is on. And they'll say something like that, or the radio's too loud. I can't hear what you're saying and I can't concentrate with that. Those are some day to day symptoms that can happen with auditory processing confusion about what's being said, recall of what's been said. We can have difficulty. Maybe you're trying to ask for directions going somewhere and you can't remember the third step that someone just told you. Go to the corner, turn left, go 2 blocks, turn right, and go down to the green road. That kind of thing. I think I was supposed to turn left and right. What was that? Kind of thing. So you'll think your memory's bad. That could actually be a symptom of auditory processing problems. Now, with visual, I think it's a little more difficult for us to naturally wrap our head around what a visual processing problem is. But this is someone who just constantly loses things, so they don't know where they set their keys. Now, I've had that happen. Tore the house apart, literally. Never did find those keys, so I don't know where they went. So there can be a little bit of something going on, but if it's a consistent thing, that's what to look for. So if you're always losing your keys or can't find your shoes or where did I put my purse or left my jacket behind again or forgot to do this or forgot to put the gas cap back on the car, pulled away with that. And I've seen all of these kinds of things happening. I also have a theory about car accidents because I'm having a theory that we could be having some visual perception challenges out there in the world. And so I wonder what that might be. Again, maybe someone bumps into things or trips over things a lot and they just think they're clumsy. So maybe people have labeled themselves being clumsy. Maybe this is actually a visual processing problem that if we could figure this out, we might be able to strengthen that part of the brain processing. So maybe that person can live differently.
That's amazing. So, any final thoughts? And also, please share with us the website and more about how we can get the book, Solving the ADHD Riddle.
I think for me, it's really about changing the narrative around ADHD and a lot of other conditions because I treat trauma. We tackle a lot of that. These are brain conditions, and you can retrain your brain. You literally can retrain your brain. It's called neuroplasticity, and we've known about it for nearly 100 years. And this just helps you employ that more effectively. And the good news is, when you train your brain, it tends to hold on to it. You go on and live your life. There's a lot of information up on my website, which is www.Connie McReynolds, which is ConnieMcReynolds.com.
Fantastic. We have Jenny Dunton, and she has been living with fibromyalgia for nearly 3 decades, and she believes the power of sharing her experiences to promote healing and to inspire and bring hope to those the most in need. She's written this really wonderful book called Fibromyalgia, A Journey of Self-Discovery. Welcome, Jenny. Thanks for being on the show.
Thank you. Thank you for having me. It's really great to be here.
Thank you. Now, tell me a little bit about how do you define fibromyalgia?
I'm going to start with the main three that doctors would actually diagnose fibromyalgia. Widespread body pain, meaning that you have pain in both the upper and lower quadrants. You have pain on both your left side and your right side, and you've endured that pain for at least 3 months. But in addition to that, the extreme fatigue is a major symptom, and in fatigue to the point where it's debilitating at times, where it's difficulty just to do the most basic life functions, such as convincing yourself that you have the energy to get out of bed to take a shower or just to make breakfast. And then there's the cognitive fibrofog is often what it is labeled for fibromyalgia, which is difficulty focusing, concentrating. Your memory starts to fade a little bit and you start to lose your train of thoughts, having difficulty finding words. But fibromyalgia is much, much bigger than those three key things. Fibromyalgia is like an umbrella word, just a diagnosis of a multitude of symptoms. There are a lot of secondary symptoms that go along with fibromyalgia. Many people have sleep disturbances. There are issues with sexual dysfunction sometimes, irritable bowel syndrome, headaches. So the list is quite lengthy. And once you get a fibromyalgia diagnosis, you find that there's this massive umbrella of primary and secondary symptoms.
No, absolutely. And a lot of those symptoms people were checking off. That sounds like an autoimmune to me. Check, check. I hadn't heard fibrofog before, but I have heard brain fog, and I'm assuming
Yep.
pretty similar.
Yep. Same thing. Absolutely same thing, just different term.
Okay.
And I agree with you. I think that doctors do argue whether or not it's an autoimmune disease. I shouldn't say argue. They discuss, and there's lots of research around it. And I think that down the line, it is going to come out that it is a form of autoimmune disease. It's just that maybe the autoimmune picture is much larger than we're giving it credit for or realizing at this point. Just because we don't know something now doesn't mean that we're not going to know it down the line.
Oh, absolutely. And I've often said, I don't really care what label you put on it, whether it's, are we saying fibromyalgia? Are we saying autoimmune? Are you saying lupus? It's a collection of symptoms. And the interesting thing I have found, and you mentioned in your opening there, was how everybody presents differently with their autoimmune diagnosis. So they get the label of perhaps fibromyalgia or lupus or something else. And yet, when you talk to two different people that have gotten that label, they can present very differently. And you're like, wow, they don't even seem to have the same issues going on. And yet they've got that same label. And I find that fascinating and also frustrating.
I do know when I was first given the diagnosis of fibromyalgia, that there was a multitude of responses. My first was, oh, good, I have a diagnosis. I finally understand what's happening to me. This is progress. But quickly I realized that having a diagnosis of fibromyalgia really didn't mean a whole lot, didn't give me any information. And if anything, it unfortunately in many regards isolated me even more because fibromyalgia does have a bit of a stigma attached to it. That stigma is leaving as more research comes in and there's more evidence. That stigma of it being an invisible, all in your head, imaginary diagnosis is finally starting to disappear. But having a fibromyalgia diagnosis and the word fibromyalgia really doesn't mean anything.
That was frustrating to me was with the idea of the diagnosis of fibromyalgia and other autoimmunes. When a high percentage is women, it is often where we're dismissed. It's all in your head instead of actually listening to us and taking us seriously and the things that were happening to us seriously. And that's part of my frustration about getting well. And one of the reasons I got the autoimmune hour started was to talk about some of the other ways that we can expand our view of what's going on with us. Now, in the title of your book, you say 27 years, and that's a long time, nearly 3 decades, as you mentioned.
Yeah.
If someone was to say, okay, I was just diagnosed with fibromyalgia, what would your first tip be for them to settle into that realization without trauma? I think just hearing a diagnosis is traumatic, guys. I get that, but
I'm so glad you asked that question because it's why I wrote the book. Because I started participating in some support groups, some chronic pain support groups online. And I would see newly diagnosed patients asking the same questions over and over that I asked 30 years ago. And I would say my number one thing is if you've been given a fibromyalgia diagnosis, don't latch onto that. It is still so into the new stages of research and so much is coming out. The most important thing to do, I believe, is to slow down, become an active learner in your illness, which we should always do, right? I think it's amazing how we know so little about our bodies and until some major illness comes along, we really don't have a clue how it all works. And so I think that the number one thing that a newly diagnosed patient can do is not just trust that the doctors have the medication, the doctors are going to be able to provide you comfort. Yes, they will be able to some degree, but more importantly is to become an active learner in your illness and learn for yourself what's going on.
there's all sorts of ways to learn that. To me, it's not just about the diagnosis or whatever you read. Make sure it's peer-reviewed research. There are basic things that we can do as well. For me, taking the diagnosis in is excellent, reading about it, learning about it, understanding it. And yet also, as I think back, I entered a period after I digested the shock of my diagnosis and digested what that meant or might mean, and had the sadness and all of that dissipate, was stepping back and what are some basic health steps I can do that may not cause a recovery, but that was the ultimate goal. But what are some just basic health steps I can do to help support my health? Those were
Right.
some of the first questions I was asking of, okay, wow, bummer, I got this diagnosis. Let me step back and say, did I play a part in getting here? Like, reflect on your life and understand what part you're playing in it.
Right. And I think back to what the newly diagnosed patient, or even not the newly diagnosed patient, it really doesn't even matter that you're newly diagnosed, but I really learned how important having a cognitive behavioral therapist has played. And it comes from a line of, like you said, you're looking back on your life, you're thinking, how did this happen? What did I do wrong? Where did I go wrong? What is it, genetic? You start having all these questions, and it affects every aspect of our life. It affects our careers, it affects our relationships, and it's so much more than that 15-minute visit with our doctor. And I think that once I started really exploring on my own what possibly triggered this, it made me realize that a cognitive behavioral therapist could really help me walk through some of these difficult conversations with friends or with my spouse or with my boss, my careers. I think that I'm hoping that modern medicine takes us along a path where we not only have our general practitioner doctor, but we also have a behavioral therapist that is our core health team to help us get through these very isolating difficult times so that we can learn more about ourselves and learn how to improve.
I'm curious. I've heard the term cognitive behavioral therapist, but I've never really researched it. How are they different from other therapists or health coaches, or what kinds of services would you expect from a cognitive behavioral therapist?
So much of fibromyalgia they're discovering now. Originally, it was thought that it had to do with just the muscles. It was a fibrous muscle tightening condition that caused widespread body pain. Now that we have better brain imaging and diagnostic tools, they're actually noticing that there are changes that are physically detectable and taking place in the brain. And a cognitive behavioral therapist is someone who can help you work with your nervous system, learn about how to calm your nervous system. They believe that a lot of fibromyalgia patients may be genetically predisposed. This may be in our genetics that we have something that when it gets triggered, we develop fibromyalgia symptoms. But it is also happening very much if we've had trauma or experienced illnesses, or if we've experienced a lot of stress. All of this is causing our fight and flight response system to constantly be engaged, and our brains are actually changing. So, having a cognitive behavioral therapist is someone who can help you to better understand your own emotions, understand what challenges you're experiencing going on in life, but also help to treat some of that past trauma that you might have experienced. There's no evidence that says that fibromyalgia can be reversed, but I am incredibly hopeful and I will die trying. And part of that will be to try to better understand what's happening in our brains. It is a brain dysfunction based off of trauma or a car accident or extreme stressful situations where we're just living in a fight or flight response. And that creates inflammation in the body. And you end up experiencing this domino of symptoms because of that. So a cognitive behavioral therapist can really help the patient cope.
And one of the things with autoimmune, and the more you're sharing with me about fibromyalgia, there's so many overlaps. So I can understand why, if people haven't put it in the autoimmune category yet, I could see that it could easily fit there, because dysautonomia or dysregulation of our autonomic nervous system is common in many autoimmune conditions. And working with the autonomic nervous system to relax and strategies around calming the nervous system are also part of healing from what they'll say categorized as an autoimmune condition. So there's plenty of overlaps we're discovering here as we chat.
Yeah, it's true. In fact, some research is saying that Hashimoto's being an autoimmune disorder, about 70% of patients, research is showing, has another autoimmune disease. For example, if you have a different autoimmune disease, you're more prone to develop fibromyalgia.
There's lots of research that if you have one diagnosis and you don't have a second one yet, you probably will.
Let's try to be proactive. I'm not quite willing to accept that as a response, but it's very valid information. And I think the more we know upfront about what is going on, the more chance we have of potentially helping ourselves recover.
And Jenny, we're just about out of time. Share any final thoughts, and then where can we find your wonderful book?
At first, I'd like to just say that I want everybody to have hope. I am so excited that there are people like you that are creating a community where those of us with autoimmune can go. It's so empowering to know that there are others out there talking about their stories. And that was a huge motivation for me. It's an incredibly isolating situation to live with autoimmune. And I think we need to surround ourselves with hope and people that can support our healing and help us to find the best way to move forward in our lives and live a full life. And also to feel empowered to know that it's okay to speak up for ourselves. We need to have boundaries in our lives. We need to not feel guilty for taking care of ourselves. Many of us live very similar stories, and we just live in different words. And the more that we share and talk about those experiences, the better we're all going to be.
Absolutely. I love to say here on the show, you're not alone. And some people take that a little negatively, and I'm not. It's not about that. It's about knowing, as I said before, confirming your sanity. Yes, what you're going through is real, and there are people who have gone through it or are going through it that are here to support you, just like Jenny and myself. So everyone, be sure and get Jenny's book. It's called Fibromyalgia, A Journey of Self-Discovery. Now, is it available online at all?
It's available on Amazon through Kindle or Amazon paperback.
Okay.
And it's easy to look it up there. And yeah, I hope that it provides people with not only comfort and my story, but also it's backed with a lot of research, scientific research, only from peer-reviewed medical journals, since I myself am not a doctor.
Not a doctor, and I
Yeah.
don't play one on the podcast either.
No.
Everyone, that's Jenny Dunton. Thank you so much. And have a great week, whatever your adventures. Join us next week for another brand new episode.
Thank you.
Enjoy. And if you're here on YouTube, please be sure and click the subscribe button below and hit the little bell to get notifications for when we upload new episodes and new clips and other amazing things I find. We're trying to grow our YouTube community here so we can offer help and hope to as many people as possible. And thank you for being part of our Autoimmune Courage Club community.
The information provided on the Autoimmune Hour, Understanding Autoimmune, and Life Interrupted Radio, including the websites understandingautoimmune.com and lifeinterruptedradio.com, plus social media, is for educational purposes only. What you read, hear, and see on the Autoimmune Hour, Understanding Autoimmune, and Life Interrupted Radio, and its websites, and other media outlets is based on experience only. The information should never be used for any legal, diagnostic, or treatment purposes.